So my name is Zeena Johar. I come from a small town called Chandigarh. It's the joint capital of Punjab and Haryana. I was actually born in Ludhiana, which is in Punjab, and it's kind of the industrial capital. I was 4 years old when my father moved to Chandigarh. I did most of my education there. I grew up as a kid who was, for some reason, absolutely fascinated by chemistry. And physical chemistry was something that I was always very, very passionate about. Then I was just very fortunate to get the opportunity to have a fully funded PhD program in drug discovery from ET at Zurich. And then I came back to India. You're talking about pharmaceuticals, diagnostics, technology, all the big research that's happening on one side. And then you're talking about rural India, which is where most of our country lives. You know, there was a huge disconnect, and that was kind of disturbing in a very strange way. And that's kind of what sprouted the idea to say that how do I really create something? I was very lucky to find a mentor, Dr. Nachiket Moore, who co-founded the company with me and has been my mentor all through. And that's where our journey started in 2008, almost for one full year. Amongst many other things that Nachiket was doing, we did a lot of travel in India. We went to Bihar, studied the Janani model. We went to Maharashtra, we went and saw LifeSpring. We just went and saw every other healthcare model within the public sector and private sector to say that what are the gaps, what is really going wrong in this country. And that's when we realized that in bits and pieces we have a lot of answers, but nobody has really thought about healthcare at an enterprise level. That how do you organize the front line for a rural villager? And that's when we started our journey at SughaVazhu Healthcare and launched our first clinic in 2009. We are a rural primary healthcare social enterprise. So what we have really created is a blueprint of an enterprise at a frontline level, wherein what has to be done is clearly defined as clinical protocols. Who will do it is defined by the bridge training program that we have for Indian medicine providers, and then we have our own enterprise solution which kind of brings all of this together, and which is what is implemented in our field site in Thanjavur, wherein we have a network of 7 clinics, and till date we have seen around 50,000 patients. So as a healthcare entrepreneur, I think it is very important for you to spend a significant amount of time defining your problem. You need to know that this is your problem. For example, in our case, I'm very passionate about organizing the primary healthcare market. And when I say organizing, a lot of elements and a lot of stakeholders have to come together. So I think a clearer definition of your problem is very, very important. And then what is even more important is a lot of patience and a lot of resilience to failure. And I think that is the same for every entrepreneur. It is not only healthcare, but I think the healthcare in healthcare the cycles are even longer, and it takes much longer before your business model, as you call it, begins to make a lot more logical sense. As an entrepreneur, you need enormous, almost crazy amounts of self-belief. And as a woman, and especially as an Indian woman, this is not a trait that we find in plenty. And I think working on this really, really helps. Another thing that really works very well, and I think maybe in women entrepreneurs it works even better, is to create an ecosystem around you. An ecosystem around you that totally believes in you, which is that of mentors, which is that of guides, which is that of critiques. You need those people, because at the end of the day, the journey of entrepreneurship is a reasonably lonely journey, and it gets even harder if there are any, if at all, gender differences that are there. And hence creating an ecosystem is very, very important. Last but not the least, finding the right partner in your life is extremely significant, because this is a journey which just is so engaging and so involving that if your better half, as they call it, is not as understanding, is not as supportive, doesn't share the vision with you, at some point, you kind of give in to the force of saying, let's just call it a day.